So first of all, thanks very much, Giuseppe, for agreeing to speak to us today. This is the first in a series of videos we plan to do where we interview oncologists around the world and see what their thoughts are and some of the most pressing challenges in practice today. So I go ahead and I'll start asking some questions. The first is, can you give us a brief introduction of yourself and your medical background?
Yes, I'm a 46-year-old consultant medical oncologist, and my subspecialties are lung and urology. I work at the Department of Oncology of the Portsmouth Hospitals University NHS Trust in the UK, but I am Italian, of course, and I moved to the UK 3 years ago. So my clinical and scientific experience and background has mainly focused on thoracic and urology cancer, and particularly on prognostic and predictive biomarkers for systemic cancer treatments, particularly immunotherapy. Currently, I'm working with other European colleagues on predictive models of efficacy and toxicity of immunotherapy based on immune-inflammatory biomarkers and artificial intelligence. I have a soft spot for academy and clinical and translational research. In 2017, I've been entitled with an Italian qualification as associate professor, and I promoted several translational and clinical research trials, joining also some European and national Italian and now also British research networks like the Italian Society for Medical Oncology, a member of the ION, a member of the British Thoracic Oncology Group, the Geriatric International Society of Geriatric Oncology, and the Italian Urology Network, Mituro. There is one thing I am proud of, and is that in 2011, with other people, other professionals, and not only physicians, I co-founded a no-profit organization which is called Medicare Onlus, and this organization aim to promote initiatives regarding the primary and secondary prevention of cancer and support cancer patients and their families in the south of Italy.
Oh, very good. That's excellent. I wasn't aware of that.
Yeah. Yes, it is something I'm really very proud of, and something that is working very well. Yeah.
Excellent, excellent. Regarding the primary and secondary prevention of cancer, do you mean is it like around cancer screening or what's the?
So actually, as primary prevention, we mean some interventions on the risk of cancers. So
Okay.
we do like seminars, or we in the schools, for instance, so with the young people, to of course encourage people to not start smoking or keeping an health diet. So these are kind of intervention. So this is the primary intervention. As a secondary prevention, which is actually screenings. So with this association, we tend to promote to especially women the screening with a mammography for the breast cancer, especially in those women under 40 years old, where the mammography is not paid usually by the health system, and also by promoting other screening exams.
Okay, excellent. That's very good. What would you say excites you most in the industry? I guess having had many years of professional experience.
Yeah, I would say three things. So the first one is the new treatment opportunities arising from our better understanding of cancer mechanisms and expanding role of translational research in oncology. I remember when I started my career, the clinicians were mainly involved just in the delivery of chemotherapy, and the researchers worked on a different world. They seem like they worked on parallel wards.
Yeah.
And these wards have finally met and start to work hand to hand. The second thing is the care and the relationship with patients, which continuously changes and takes different shapes. You would never imagine, and it's also challenging to explain actually, but relationships with age become more mature and rich in, I think, compassion and humanity. And on the other hand, you realize that there are different ways to care, not just with chemotherapy, immunotherapy, or other systemic treatments. There is a holistic approach. And the third thing is that professional relationships and friendships with other colleagues. We create some, we have this great opportunity to create some virtuous circles of professionals which are built up because we choose each other and work together irrespective of the physical distances. In a word, in my industry, you never cease to learn, amaze yourself, and grow professionally and humanly.
On your final point, Alfredo and Fabio, who we've collaborated with, how do you know them? How did you meet them?
So actually, it was just my initiative. Okay. So with Alfredo was really a nice story because he used to work for 8 years in the UK, and then he moved to the Switzerland. And so we met during a conference. It was a thoracic conference of the ETOP group, which is a European network for lung cancer. And we met at that meeting, and we had never met before that day. And then we just changed our telephone numbers. And I remember that I was doing some interviews in the UK when after one of those interviews, I received his call. And it looked at me as a sign, because he had a huge experience in the UK system. And so he explained to me everything about the interview and about how to do other interviews. And so we became friends, actually, because we gave and we are giving each other advices other than the professional, but and then we start to work together. And the nice thing is that since we start to work together, our we say age index, so the publication index has dramatically risen, and this is because when you get along with other people, is a good example of friendship, but also of a professional relationship. With Fabio was a different story because I met him during a conference, and then I said he was at the Christie Hospital. I was just arrived in the UK, and I said we need to work together, and actually it happened.
Excellent. Okay, that's very good. Yeah. So I'd assumed Alfredo was a university friend, or he had studied together.
No. We just met at that conference. It was 4 years ago. It seems that we know each other since we were children, but actually we met just 4 years before.
That's excellent. Yeah. That's great. That's great. And where does he work in the UK? What was his?
So now he's working in Geneva, but he used to work in Lincoln for, I think, 4 years or 6 years, and then the last 2 years he worked in Bristol.
Okay, excellent. So the next question's around ONCOassist, and how did you originally find out about ONCOassist, and why did you decide to install the app?
So I had a smartphone for years, I think, and since the very beginning, I used apps for generic medical formulas. I cannot remember exactly when, but a few years ago, I was searching for a specific oncology app with staging and prognostic tools, besides the formulas that we currently use in oncology. And I found ONCOassist, and immediately I loved it. and I start to use it regularly, and also to assist to its exponential growth. And I remember that a turning point was the implementation of the CTC toxicity grading system, which I start to use regularly for patients on clinical trials, but also outside clinical trials in clinical practice.
Okay, great.
Probably you don't know, but when you have patients on clinical trials, you need to record the toxicity of patients, because when you in the so-called source document, you need to record all the toxicity of patients. So actually, before ONCOassist, there was a pocket book, and so you needed to see in the pocket book the toxicity, because you need to grade, because it's not just a matter of fatigue, but you need to define the fatigue. Is it G3 fatigue, G4 fatigue, especially for hematological toxicity, because with hematological toxicity, you need to grade the toxicity according to the blood value, so you can't remember the blood value. So actually it was very helpful, because immediately, because it's something that otherwise would be very time consuming.
Yeah.
And and so as I had a lot of patients on clinical trials, it was really a revolution, because actually I switched from the pocket book to the hub. So it was fantastic. Yeah.
Excellent. Is there any way we could build on that and further?
I think that I think that is quite useful in this way. So I don't think that is. While I was preparing this interview, I thought that possible evolution. I think that you have thought about that, but could be the implementation of guidelines, which is something that I know that Navify is doing. So like we discussed about Navify. So it's something that probably is missing currently on ONCOassist. So the possibility even to have access, I know that probably is not possible to have access to the NCCN guidelines, which has those algorithms, which are quite useful, but possibly the implementation with guidelines would be really helpful. So, because when you are in front of your patients, you could rapidly know what evidence says. I know it's not easy, because you need to choose also which guidelines for each tumor, but I was thinking, as there is the toxicity tool, prognostic tool, staging tool, probably the only thing that is currently missing is the
guidelines.
Exactly of the. And the other thing is that, of course, another thing that I thought could be really helpful would be the possibility to discuss cases within in a social or in a 2.0. So if you post a case and you could get back some opinions as the communities, because as you saw with the survey, we got a lot of replies, which means that anyway the community is quite responsive. That could be to keep to make more active the platform, to involve more clinicians in the discussion, possibly of complicated cases.
We've looked at that before, and one of the pieces of feedback we got is that it's like so hard to summarize a patient in one. Like the patient is so complicated that it's hard to upload all of the relevant data to help.
No, that's true. That's true, but not by providing some algorithm, but leaving open a discussion. So like creating a system like a 2.0 system. So you can, for instance, there is even a link. So it's what, for instance, is doing ONCOalert. So it could be even a link to ONCOalert, just where you can post a case, a patient case, so a clinical case, and you can get some advices from the community. So just in the future, it's something that could be interesting to implement.
What would be the information you would need to post about the patient? Would it be just
so
like
for instance,
age?
Yeah, so, but I would leave like a blank, no blank, is an empty box. So where I could just write the list. So like a Twitter with a limit of words, and you need to concentrate the question within a limit of words, and then you can get some replies. It's something that we are doing on Twitter actually. So, for instance, a week ago, I launched a poll about complicated case of a patient with renal cancer I saw. And so I asked for this, you know that with Twitter, you have the limit of the limit of words. So I said, with this characteristic, what would you recommend? And I put like four answers. And so I got approximately 10 votes. It was not enough. Not so much, but anyway, it was quite. And also you can vote, but you can also yes, and also post a comment, for instance.
Okay, that's really good feedback, and I'm going to pass it on to the two guys. I think we have a lot of the software to do that, so we might pilot it and see how we get on.
Yeah.
How do you use ONCOassist on a daily basis? You mentioned toxicity grading.
Yeah, exactly. Yeah.
Are there other sections you use?
Yes. Firstly, I use ONCOassist daily when seeing patients in clinics. So I use regularly for toxicity grading, as I mentioned, and also for drug interactions checks, which is quite very helpful, and but also to assess patients for frailty. So especially when I see patients for the first time, I tend to go beyond the performance status assessment and use the tools which are provided by ONCOassist in terms of frailty. And then I often use it also for smoking pack years calculator, the PSA doubling time, and sometimes when our MDT has not staged the disease for the TNM staging. And what I'm finding also very helpful in the clinical practice is the immunotherapy toxicity tool. So to score and also to get some information, immediate information about the treatment of patients according to the grade of the immunotherapy related toxicity.
Okay, great. Good to hear. It's helpful. Looking forward, we discussed the kind of social element of ONCOassist. Is there any other industry problem that you think ONCOassist is well placed to solve?
So actually, I think that ONCOassist is a valid and helpful aid for the daily clinical decision making, because as oncologists, every day we are called to take several complex decisions on a case-by-case basis, which are of course aimed to offer the most effective and at the same time safe treatment on a very individual basis. And we do that by gathering in our minds the most updated and established scientific evidence. But this implies that, of course, our brain is continuously working and requiring for mental algorithms. So the utility of ONCOassist app is to help us to make a critical mass of evidence to tailor treatments for our patients on a daily basis.
Yeah, of course. So why did you decide to pursue a career in medicine and specifically oncology?
So yes, I cannot hide that I brought up in a family of doctors. So my father, my grandfather were surgeons, and in a certain way they transmit to me the passion for the medicine generally, and also I would say also on how relevant in this job is the responsibility that you take for other people. So afterwards, during the last year of my secondary school, my favorite teacher unfortunately died of cancer, and that I think that was very relevant for me to take this decision, go ahead with medicine and also with oncology in particular. And I was able to pass the exam to access the medical school, and one of my first teachers of statistics actually was a cancer epidemiologist, and I remember that he gave me immediately the idea of the importance of the methods and research in oncology. I remember that he gifted me a book on the epidemiology of cancer, and so I realized that that was my way. And actually, I was very lucky because I had the opportunity anyway to follow this path and to become what really I want to be, and to enjoy this wonderful job anyway.
Excellent. Brilliant, brilliant. And what part of Italy are you from, Giuseppe?
I am from the south of Italy, so Sicily.
Okay.
I don't know
Sicily,
if you have, yeah.
I've never been. I'm familiar with it.
You must go.
I hear it's beautiful.
It's a wonderful place where to spend holiday. Probably a little bit less working, but it's a wonderful place where, yeah, for holidays, fantastic.
I hear, I hear the food. I would imagine is incredible.
Yes, good. Yes, good. Actually, I think that in Italy, wherever you go, it's difficult to to have not a decent food. But there are some regions in Italy, and I think that in the south, it's very good.
Is that a lot of seafood?
Yes, exactly. Especially because the city where I was born is in front of the sea. Catania is just in front of the sea. So yes, we used to eat seafood and fish in general.
Beautiful, nice. So what are some of your biggest challenges day to day as an oncologist?
So I think that one of the biggest challenges is to keep up with the literature, scientific literature, and to make a critical mass of all the information that we received from several sources, including the social networks. And so the following challenge is to offer to each patient a tailored treatment based not just on what is recommended or licensed, but also on their preference, on patient preference and expectations, of course. And so to match evidence with really the patient you have in front of. And then, of course, is to translate the novelties, so the new diagnostic procedures, the new treatments into your real clinical practice. This is another challenge, which is not very easy. And also because, unfortunately, not in all the centers, clinicians are recognized also as clinical researchers, and also are not, when they are really committed to clinical and translational research, this aspect is not always adequately valued.
Okay.
So the last challenge I forgot.
I see. Yeah.
That is more personal, of course, and is to keep at the end of the day to keep a proper balance between work and family. This is very difficult in any work, in any job. But I think that for oncologists is a huge challenge, because
I can imagine, yeah.
when you come back home, you should forget what happened during the day and try to enjoy your family life. But it's not always easy, because of course the involvement, not just in the things that you need to do, but also in the relationships that you had with patients, all the problems, is quite challenging.
I can imagine. Yeah. Do you have children?
Yes, I have two children. One of 30. So one is 13. The other one is 11th. And they Yeah, two daughters. So
Yeah.
two
I have two
girls.
boys, 4 and 9.
You guys? 4 and 9.
4 months and 4 years and 9 months.
Oh, so yeah. So you are still not sleeping.
No.
So yeah, in the phase that you are still not sleeping during the night.
Yeah. That's the. Hopefully it'll pass.
Yeah, it will pass.
So the next question: a positive impact of COVID-19 is the adoption of digital health. Can you give us a few examples of your experience around this?
Yeah, I think that most of the education and training, especially in the last year, but also research networking, has been currently conveyed in the virtual format, which of course has limited the personal interactions, and is not very good, because as I mentioned, my best friendships and relationships actually happen during meetings, so with a physical meeting. But I think that also this represent an opportunity, a new opportunity, because, for instance, I've been involved in the last year, in several new collaborative research networks and virtuous circles with international collaboration, which have been very productive. Probably it was also because we traveled less, and actually we spared a significant amount of time. Probably we have also impacted less on environment. And I think that it has helped to avoid accumulating also backlog and being more available and effective. So this has, of course, also refined, I would say, our interest and knowledge in these new digital health technologies, and especially on how we can use to spread timely and effectively relevant and verified information with also, I would say, an ethical perspective, because the aim, the right aim would be to help each other to keep posted and interact at several different levels. And I want just to give an example of that, which is a network which has worked in the last year, which is the ONCOalert, which put together professionals, but is now open also to patients' advocacy. So it has served as a network to share opinions, to share evidence, information, also to people who are not professionals, and also to help each other, because it has allowed us to interact with people who possibly have not the same opportunities to keep up with the literature as it is for us.
Yeah, of course, yeah. Gil Morgan has done great work there.
Really a nice place where we could share our opinions. And also, I think that is quite important because the problem on social networks is that very often they are followed not just by professionals, but also by patients who have not the tools to, to understand what's happening in terms of evidence, information. And also on social networks, sometimes there are some even colleagues that tend to promote their papers, and also to emphasize probably too much the real value of that evidence. So ONCOalert is a board, actually. It's a board of professionals who, of course, will also verify the information, so will give a proper information. So it's like a way also to verify an information which otherwise, of course, could be not so trustful.
For any patients and caregivers watching this, what are your tips on navigating cancer?
Yes, my advice is to verify always the source of the information. If that is trustful, there are many, I would say, divergent interest in delivering an information. So it is always important for patients to check and to verify what is the source of the information, and if the information has been verified. And I think that the best way is always to ask, so not to rely just on the social networks, but also to ask to a friend who is a doctor or a specialist, of course, because for some important, relevant information, what is really important is to rely on the validity of the information. So it's important also to have a physical approach with a physician and to trust on him and to trust on the on how he or she went through that information.
Okay.
So
great.
asking to doctors.
Yeah. Okay. Great. Yeah. That's, in this day and age, that's a really important piece of advice.
Yeah, I think so.
Yeah. Brilliant. Okay. Thank you very much.
Thank you very much,
Giuseppe.
Kevin. Have a nice weekend. And you with
too.
your kids as well.
Thank you. Take care.
Take care.